Hello, and thank you so much for tuning into my podcast. My name is Kara, and I'm a holistic health practitioner for both people and pets. After working for years in the conventional medicine field, I realized that while our lifespans may be getting longer, our health spans are rapidly shrinking. And when it comes to our pets, both their length and quality of life are decreasing. When I turned to functional medicine and a more holistic approach to health, I saw dramatic improvements for my pets, myself, and my patients. Join me each week as I merge natural health for people and pets by focusing on the root cause of disease and applying raw, real remedies that you can use to improve overall wellness for every member of your family, including the furry ones.
Hello, everybody, and welcome back to Raw Remedies podcast. Today, Dr. Olivieri joins me once more for the final segment, part 3 of our metabolic health series. Parts 1 and 2 were amazing, and Dr. O really showed her extensive expertise in metabolic health and metabolic-related conditions, so please be sure to listen to parts 1 and 2 as well. Before we dive in, I do have a quick word from my sponsor, which is Girls Gone Raw Pet Health. Girls Gone Raw is an Ohio local business started by a girl with an uncontrollable passion for pets and all things natural, which is probably why I get along with her so well. At Girls Gone Raw Pet Health, their goal is to provide unique, nutrition-packed, carnivore-focused dehydrated treats and chews that pets go nuts over. I know that mine personally love their beef tracheas and scapulas, which are super chews for your gulping dogs like my golden retriever. You can feel confident feeding their hand-selected, high-quality, human-grade meats and knowing that they foster relationships with small, generational family farms and scour the market for the freshest, most unique products available. You can get 10% off your order with the code RAWREMEDIES at checkout. And now, without further ado, let's finish up our metabolic health series. Hello, everybody. Welcome back. We are now in part 3 of our metabolic health series with Dr. Chrystyne Olivieri. And as you know, if you listened to part 1 and 2, which I hope you did, and if you didn't, you should, we started with the slow burn of metabolic dysfunction. And now today we're talking about the entire systemic inferno of what can happen when you have metabolic dysfunction. So Dr. O, again, thank you for coming back for part 3. I'm excited to wrap it up and really just bring it all together for everybody.
Well, thank you so much, Kara. It has been my privilege to be able to do this with you. This is something I'm very passionate about. I know you are also. So thank you.
Yeah. I mean, this is, I think, a topic that applies to everyone across the board. Doesn't matter if you're a pet parent, doesn't matter if you're just listening for yourself. It doesn't matter if you don't have any actual, diagnosed medical conditions or if you're not on any medications. This is our metabolic health is our entire health and well-being. It all starts with metabolism. So I'm excited to hop into this, and I'm just going to preface really quick and say, I am very sorry if everybody hears the chirping behind me. I'm going to try and filter it out, but I did get chicks, and you can't tell chicks to be quiet, and they happen to be in the room with me today. So I wore my chicken shirt just to, celebrate that I'm recording with chickens behind me. But if you hear chirping, it's not your imagination, and it's not your birds outside. It's my chickens.
I love it. I just love it.
All right. So we're going to dive in and talk about how high blood sugar and also high insulin, right? Hyperinsulinemia is related to chronic disease. So can you just get us started with that?
Okay. So as we talked about in part 1 and 2, where we talked about obesity, which is actually the result of having some elevated blood sugars and elevated insulin levels. And it all starts with what you eat. So the first part of our series was about obesity. The second part, we really dove into type 2 diabetes, which is the most prevalent type of type 2 diabetes. But now we're going to talk about what happens specifically, metabolically speaking, about high blood sugars and high insulin levels. Now, most people will run around with high insulin levels for a decade or so before their sugars start to rise. So we see absolutely nothing when it comes to how your body is functioning, other than a little bit of fatigue, maybe some sleep disruptions, maybe a little bit of belly fat gain. Some people just don't have the genetics to gain that belly fat, but it doesn't mean that you're not having high insulin levels, which will eventually, after 10 to 15 years, result in high blood sugars. And I always say that the luckiest people are the ones who do gain weight, because at least they have that metric that says, ooh, I'm eating too many carbs, too much sugar, maybe I should lay off. But everybody has that friend out there that can eat anything they want. They never gain weight. They're having ice cream every night and they're having chips all day long, and they never gain weight. Those are the people that are unlucky because they don't have the metric that says, "Ooh, I should lay off these junk foods."
Yeah, I know people like that. I think I'm a person like that. I used to love my snacks and my ice cream. Ice cream is definitely my weakness. But you can have that skinny fat, right? Where you look skinny on the
Mhm.
outside, but actually your metabolic function on the inside is not that great. Which is definitely a problem. And I like how you brought up those levels, right? How it takes a while for those levels to rise. I want to
Mhm.
take it back really quick to part one. So if people recall, we had talked about different markers that you can check in order to assess for metabolic dysfunction. And Dr. O had mentioned C-peptide, which is
Mhm.
a more stable level of kind of checking your insulin in the blood, instead of a fasting insulin, which is
Mhm.
not going to hang around as long. And then
Right.
your A1C, which is that 3-month average, which is much
Mhm.
further down the line. And then the last and final thing you see is an elevated fasting glucose or fasting
Right.
blood sugar.
That's the last thing you see. Yeah.
That's the last thing you see, and yet that's the first thing we look out for, right, in
That's
conventional
right.
medicine, which is too bad. So I didn't know that I could check a C-peptide level on someone using that metabolic syndrome code, right?
Mhm.
Well, since then, now it's been 2 months, I have checked that on several people and found normal fasting blood sugar, normal hemoglobin A1C, and normal fasting insulin, but elevated
Ele
C-peptide.
elevated
So
C-peptide. Yep.
elevated C-peptide, because that's the first
Mhm.
thing that goes up, and so we were able to really head off what would have eventually spiraled
Wonderful.
into worse metabolic dysfunction and probably eventually type 2 diabetes, and now these
Wonderful.
people are able to apply lifestyle changes to head that off and reverse it. So,
Yeah.
knowing what you can check and then what you can do about it, I think it just is really, empowering.
Yeah. And sometimes someone needs to see it in black and white in front of them.
Mhm. Yeah.
Unfortunately, the people who don't see it in black and white in front of them say, "Oh, okay, I'm good. I can go back to eating my cheesecake, every day." But you have to realize that most infectious diseases are overcome by antibiotics, and those antibiotics do have an effect overall on your body.
Mhm.
And that is something that is going to affect how your body metabolizes things. And
Yeah.
once you have high levels of insulin, you're going to find that your mitochondria start to die off. And you
Mhm.
can have such little mitochondria left in your cells, which is what is giving you energy to function every day. And you have a lot less of that. So, between killing it off with the microbiome with the antibiotics and with the junk foods and too much sugar and carbs, eventually people end up with a fatigue. And that's one of the first things that people do complain about when they come in to see the doctors. I'm so
Yeah.
tired.
Tired. Yep. And
Yeah,
what do we say? Oh, you're stressed. Oh, you need, me time. Oh, you need to get more sleep, right? It's so easy to just say, like, oh, well, just do better. Like, oh, manage your time, manage your stress. Never really getting to that underlying pathology. And
right.
I feel like when it comes to the gut microbiome, I am constantly like up on my pulpit preaching to people.
Hmm.
Like, it is so imperative. This is so much of your immune system, of your metabolic health, your gut diversity. Your gut bugs outnumber you 1,000 to 1. You're more
Right.
microbe than you are person. so,
Exactly.
so it's
Exactly.
super important. Yeah, and antibiotics can really lead to a lot of chronic diseases, unfortunately, down the line. That downstream
Yeah.
effect, right?
Yeah, I
Yeah.
definitely want to talk about that before this podcast ends. But you know what? People don't realize that our medical system is really only about 100 years old. That's not
Hmm.
long. We had really not very much as far as treatments other than natural treatments in the 1920s, 1930s. Then we started developing antibiotics. So we kind of definitely got on top of infectious disease. Then we
Hmm.
ended up we had even advances in surgery once we had anesthesia, so we could get on top of injuries that caused people to be sick. So we got rid of most of the infectious diseases. We got rid of people being infirmed because of injuries, because now we can fix your problems. But now we are left with, ever since the 1950s, 1960s, we started eating a lot more processed and ultra processed foods. Now we're left with nothing but chronic disease.
Hmm.
And
Yep.
for about two or three, maybe even 4 generations, that's all people know
Yeah.
is chronic disease.
Yep. It's Dr. Mark Hyman who likes to say, there's a pill for every ill. right?
Mhm.
So we've certainly evolved as a society, and medicine has evolved. I mean, people are living longer than ever, but I have a
Mhm.
feeling we're going to see that pendulum start swinging back, because the people who are living the longest right now are people who are in their 70s, 80s, 90s, right?
Mhm.
Well, when they were young, food was still food, and we didn't
Right.
have the overuse of antibiotics like we do now, and we didn't have as many environmental toxins and all of these convenience products and as much stress and as much
Mhm.
stimulation, right? All
Mhm.
of these things are showing us, I don't know what you see, but in my practice, I see people who are 80s, 90s with maybe they've got cholesterol, pressure, and heartburn. I don't know, right?
Right, right, right.
But I'm seeing 40 and 50-year-olds with MS and
Yes.
diverticulitis and irritable bowel
Yes.
disease and early onset coronary artery disease and
Mhm.
memory problems. And right. So the older generation are living the longest. They have less medical problems right now than the mid generation, 40s, 50s, who are
Mhm.
suffering from a lot of chronic illness. And
Yeah,
that's the generation that's been exposed to all of those things I mentioned for so many
that's
years.
right.
And it all
See,
comes down to metabolic dysfunction.
right. I'm the end of the baby boomers. So you're really talking about the baby boomers. So there's people that are now in their 70s and 80s and maybe 90s.
Hmm.
Those are the boomers. So I'm at the end of the boomers, and I was raised in the 1960s with fast food. It was
Yeah.
everywhere. Nobody knew it was bad. My mother, she did a lot of cooking when I was a kid, but we did go out once a week for fast food and once a week for maybe a restaurant. It was usually a Chinese restaurant. So we were the first generation to really start eating poorly. I was raised on Captain Crunch and Frosted Flakes and, Wonder
Yep.
Bread and peanut butter and all this stuff.
Oh, yeah.
We were the first generation to eat that stuff. So now people that are in their 60s, you're finding, are going to be having a lot more chronic diseases. So the 70s and
Yeah.
80s, these people are doing okay. But the people that are now reaching their 60s, not so good.
Yeah. Yep. And that food has continued to, well, I call it food loosely, but that those ultra processed food products have continued to devolve since then. So, I mean, back in the
They're
60s,
even
McDonald's
worse.
still made French fries with tallow. Now they
Yes, I
use
know.
peanut
Yes.
oil, so it's just, has continued to get worse, but that's my
Right.
tangent.
Right, right. But, we now have all of these dreaded diseases that everybody is, believe it or not,
Mhm.
starting to accept that when you get old, you're just gonna get them, which I
I
think is
know.
horrific. But they are all avoidable. That's the whole thing. Okay, you can't avoid Huntington's disease or Tay-Sachs disease or sickle cell anemia or cystic fibrosis. You can't avoid that if that's in your
Mhm.
genetics. But everything else, it's avoidable. Multiple sclerosis and
Yep.
Alzheimer's disease. These are, I would have to say, 90 to 95% avoidable.
Yeah,
You know?
and I can't wait to get into Alzheimer's disease and type 3 diabetes. But I love that you
Yes.
mentioned MS, because when I was in, I think still nursing school, and I started learning about MS, that is probably the thing that I was the most terrified of as a young
Mm,
woman, right? Because young
yes.
women in their 20, 30, 40s are the highest population to get diagnosed with MS. And when I learned about it, I learned it's random. Could be a
Right.
genetic component. We're not
Who
really sure.
knows?
It's a neurodegenerative disorder, right?
Who
We don't
knows?
know.
Right.
And I was like, oh my God, what if that's me one day? That's
Right.
terrifying. The loss of function. Like, what would I do?
Right.
And I encourage anybody who is afraid of MS or who has MS, or who has a family history of MS, to look up Dr. Terry Walls,
Oh, Terry
because
Walls. Yes.
mhm, I've
I
learned
know her.
so much from her, and it took the fear away from me. She
Yeah.
completely resolved her MS symptoms
Hmm.
by fixing her gut.
There
And
you
she has a
go.
whole protocol, and she talks about how many servings of sauerkraut she eats a day. But this just
Yep.
goes to show that all the things, when it comes to health, starts in the gut, and your gut is your main driver of your metabolism. So,
Absolutely.
yep.
But when you know something, when it comes to things like hypertension and the cardiovascular diseases, I don't know if you're aware, but the American Heart Association changed the statistics in 2018. They released their
Mhm.
statistics many years beyond, earlier than what we are. So even though we're in the mid 2020s, we don't have statistics that are that recent. But anyway,
Mhm.
statins came out in the 1980s Lovastatin was the first one, came out in 1980. Atorvastatin, which is Lipitor, didn't come out until 92, I think, something like that.
Oh, I didn't know
But,
that.
despite all these statins that we have, the statistics of incidence and prevalence, which is new diseases or the overall how many people in a population have the disease, continues to rise. If
Yeah.
we have statins, why does the disease incidence and prevalence continue to rise? Now, the interesting thing is they have done studies, especially gathering data over the course of the last maybe 15 to 20 years. And they have found that about 75% of people who go into American emergency rooms with chest pain, elephant on my chest, oh my God, my left arm, my left jaw, oh my gosh, I can't breathe. These people are immediately put into the cath lab, immediately get a stent, or worse, they go upstairs to the OR and they get their bypass surgery. 75% of these people have normal cholesterol that the American Heart Association says is the goal. So if they know, and we do know that cholesterol is not the problem of the heart disease. So what is it? If statins worked, why are the numbers rising? Because it's not about your cholesterol. It's about your sugar and insulin. And
Right.
the American heart doesn't want to change that stance because you know what? How many cardiologists have told me through the years, hey, so I'm not an endocrinologist. I don't do A1Cs. I don't check
Yep.
people's sugar. Don't
Yep.
tell me you don't understand the connection between high sugar and coronary artery disease. Don't tell me you don't understand that.
Yep.
And the problem is that all they want to do is the quick fix. Let's lower LDLs and total cholesterol with a statin, but it doesn't protect people. I don't know
I
if I
agree.
told you. Yeah, I don't know if I told you, but last summer I get a call from one of the cardiologists who send me patients, a lot of patients. He sends me so
Yeah.
many. Calls me up and he said, I just want to tell you that one of our patients that you see just got 2 more stents last week. And I'm like, oh, wow. So I go into the man's chart. I look at it. I got his A1C. He was an out of control diabetic. I got his A1C consistently down to around 6.2, 6.3, which is pretty good for a person with diabetes, right?
Yeah.
I looked at his total cholesterol. Over the course of the last 2 years, it's been 84. Total cholesterol of 84. His LDLs were 33. So I said to him, I said, Mike, now do you realize it's not about cholesterol? This man is going to continue to have stents or need more stents because his disease progresses because he has diabetes. We can lower his sugar the best we can, but then you start walking that fine line between lowering it too much and now you have low blood sugar. But it's not about cholesterol. It's not.
Correct. These 2026, they are making new guidelines. And I didn't read everything. I saw it the other day. Someone sent it to me.
I just
It
saw
was
it too.
you
Yep.
just saw it too. It was a cardiologist who was talking about, standard
Mm-hmm.
of care and gold
Yep.
standard and what you should check, blah, blah, blah. Well, they added a couple of things that I like. So now they recommend checking an LP little a on people.
Yep. Yep.
Um,
That's good.
which I think is beneficial because I would say 90% of conventional people who don't know what that is. And then an ApoB as well. But what
Yes.
frustrates me is, so they say, okay, check these. And now they're recommending that the LDL be brought even lower if you
Less than
have disease.
70 is what they're saying.
And so it used to be
Which,
less than 100. Not enough emphasis still on the lowering of triglycerides, which I feel like it's confusing for people that triglycerides are on a lipid profile, but
yes, I
really it's
agree.
actually a marker of your sugar intake, truly.
Right.
Um,
Exactly.
but what made me so mad about this cardiologist that was talking about these guidelines is she said, this made me so freaking mad. She said, LP little a is genetically, it's your genetics, and you
Uh-huh.
can't do anything about it. Diet doesn't do anything, lifestyle doesn't do anything, and exercise doesn't do anything. And the mainstay of treatment is statins.
But
Did you know that statins elevate your LP
right.
little a?
Right.
And diet, exercise, and lifestyle lower your LP little a. So I was like, oh my
Thank
God,
you.
you just lied to people, TikTok
That's
doctor.
right.
I was very
That's right.
upset.
That's
Very
right.
upset.
Because it's all about
I
the
don't know.
quick fix. Take this
Yep.
pill and you won't have a heart attack. You won't have any more stents. And
Yeah.
it's not true. And that's why the doctors turn around and go, we don't understand why it happens. It just happens. You got bad genetics. You got a bad hand dealt to you when you were born.
Yeah.
That's so not true.
I know. I mean, I do know some people who do have familial hypercholesterolemia. And you know what? For those people, if they have to be on a statin because they're getting I mean, they are at a significantly higher risk for cardiovascular disease at an early age, right? That is a minority. And
That's a very small minority.
very small number. And then, I mean, let's just for a second flip to animals.
Mhm.
I have seen dogs with elevated cholesterol panels, and I have
Really?
seen dogs with cardiovascular disease. And
Really?
it is crazy to me that animals who are designed to thrive on a high saturated fat diet
Do better.
are getting these diseases, right? Because that's what we tell all the people, right? Is, oh,
Right.
lower your fat,
But
lower your fat.
no,
No,
no.
why are our dogs and cats getting heart disease? Because they're on a high
Sugar and
carbohydrate, high
carbs.
processed diet
There
with
you
no
go.
omega-3s, by the way,
Right,
no
right.
omega-3s. And so, and then the argument will be, oh, well, there's no omega-3s in meat, right? It's wild animals. It's just meat. It's omega-6s, right? It's your saturated fats. Well, no, wild animals are significantly higher in omega-3s because of their diet, because they're not eating grain and corn and GMO soy. They're eating
Right.
grass. And,
Exactly.
so, yeah. So, your difference between your grass-fed beef and your feedlot cow. So I went off on a little bit of a tangent there, but our animals should not be getting heart disease and
Of
people
course
shouldn't
not.
either, but lifestyle is hard to change. It's
Right.
hard to change.
But
Willpower
when
is hard, and who you hang out with really influences that.
but you know what? When your cardiologist gets absolutely 0 nutritional education, then they don't feel prepared to give you that as a patient. They
Right.
cannot give you nutrition. So they send you to a registered dietitian.
Yeah.
And the registered dietitian schools are funded by big food companies like
Uh-huh.
ConAgra Foods and Kraft Foods. And they provide the food for the training in these programs and
Yeah.
make sure that these people learn, if you will, that carbs are necessary for health, for human health. They are not. They're
Yeah.
not necessary. They're nice. I don't want to say don't have your fruit, your vegetables and fruit in season, but
Uh-huh.
they're not necessary for human health, but they are taught that. So when a cardiologist finds someone who has heart disease and the person goes, well, maybe I should see someone to talk about my food. Yes, I think you should go to this registered dietitian. And they say, well, you can have oatmeal for breakfast and you should have whole wheat bread and whole wheat pasta. And then they end up with heart disease.
Yeah.
It's just it's so much misinformation out there. And that's one of the problems.
Yeah. That's why I like the paleo diet so much. And like even the Mediterranean diet. I do kind of like a Mediterranean paleo mash. That's kind of how I approach animals too. That low glycemic, fibrous
Mhm.
vegetables and
Yes.
seasonal eating, I think is one of the best things that people
Yep.
uh, can do. I mean, my one exception maybe is blueberries. Like I really love blueberries and I put them in my cottage cheese in the morning. So like I'm eating my blueberries year round when really I wouldn't be able to do that in ancient times. But everything else, I'm eating my sweet potatoes in the fall and I'm having my spinach in the summer, and it's my
Exactly.
organically raised in the garden spinach, not my
Yes.
pesticide laden spinach from the store.
Exactly, as often as you can anyway, because
Yeah.
not everybody has access to a good amount
Right.
of organic foods, but as
Yeah.
often as you possibly can. Yeah. So, should somebody develop coronary artery disease,
Uh-huh.
despite taking their blood pressure pills and their
Mhm.
statin medication to lower their total cholesterol and LDL, and they march on with their diabetes and it's poorly controlled, so they end up with coronary artery disease and they get a couple stents, or worse yet, they ended up with bypass surgery. They're going to end up with heart failure.
Yeah.
Now, there's two main types of heart failure. One is with a reduced ejection fraction, which is a marker for us to see how strong your heart is beating. And usually, you'll see a lower ejection fraction on certain tests if someone has had a heart attack or has some stents, because there's damage
Mhm.
on the heart. But did you know, and I should say, I know you know, that there's a heart failure with a preserved ejection fraction, which is due, we call it diabetic cardiomyopathy, and it's due to the advanced glycated end products of glycation, which is sugar metabolism, because we know that sugar innervates every single muscle in your body. So that is evolutionary because when you were a cave person, if you needed to quickly run away from a swarm of bees or a bear or some other danger, you needed
Yeah.
that sugar next to your muscles to be able to feed your muscles so you could run away really
Mhm.
fast. So we still have that. Every single muscle in our body has some sugar or glucose molecules sitting right next to every muscle cell. It happens in the heart too. Now, should you end up with a lot of blood sugar, such as in a person with prediabetes or diabetes, you're going to have too much sugar innervating that heart muscle. And that doesn't affect the beating of the heart, the contraction, which is what
Mhm.
you would see as a reduced ejection fraction. You actually have
Right.
a fibrosis happening in the heart where when it relaxes, it cannot relax efficiently. It's just as bad, if not a worse heart failure, and it probably accounts for about 80% of all heart failure patients out there.
Yeah. I see a lot of people with HFpEF, right? Heart failure
Mm,
preserved.
yep,
Um, Not as many HFrEF, which is heart failure reduced, right?
right.
And it's funny. The mainstay of treatment, of course, always ends up being diuretics or things that help
Uh-huh,
you pee so that you don't have fluid
uh-huh,
overload. And
uh-huh.
now we've got those they're actually biologics like Jardiance and stuff like that,
Oh,
right? So,
yeah,
so everybody's
yeah.
on
Ugh.
Jardiance or Entresto, which those
Mhm.
come along with a whole host of
Oh,
side
yeah.
effects.
Oh, yeah.
And maybe they're on a baby aspirin or they're
Uh-huh.
on like an Imdur or something, right, to help dilate coronary arteries. And it's a very minimal addressing of
Actual issue.
the actual underlying disease process, that metabolic
Right,
dysfunction and the need for good blood sugar control. We just don't talk about it when someone has,
right,
pure cardiovascular disease, right? Oh, well, they
right.
don't have diabetes on their blood work, so we got to just treat the heart.
Right, right. And they may have prediabetes, and if they don't have prediabetes yet, they probably soon will because it's
Hmm.
really unusual to have coronary artery disease. You see it more in people who are heavy smokers without having sugar issues. But
Yeah.
most coronary artery disease, and then of course subsequently the heart failure, really stems from elevated sugar and insulin. So even if you don't have high sugars yet, oh good, I don't even have prediabetes. Yeah, but your insulin is through the roof.
Hmm.
But
I'm curious. Do you think that there's any link between a more of a dilated cardiomyopathy and insulin
I would think so.
resistance?
However, they have found some genetic links to that. A
Okay.
dilated cardiomyopathy. You're basically talking about HOCM, which is hypertrophic cardiomyopathy. It's where
Sure.
it's extremely dilated. Now, if it's not due to unaddressed hypertension, which puts amazing stress on the heart, and it's not due to diabetic cardiomyopathy, there
Yeah.
is a genetic link with HOCM. I worked in cardiology for many years, so
Yeah.
that is something that they may not be able to explain away with high blood sugars, high insulin levels, obesity, hypertension uncontrolled. Yeah. So there is a very, very small percentage of people who have HOCM.
Yeah, I'm curious about that now. My brain is turning because I don't see too many people with dilated cardiomyopathy. Um,
We have kids who can show up with that. Yeah. So
yeah.
that
Well, and athletes,
yeah,
like you see, like they say,
athletes.
like, oh, if there's sudden death in an athlete, look for Hokum.
Yes.
But
Yeah.
interestingly, there's dilated cardiomyopathy, which I'm just going to say DCM from now on, is a
Uh-huh.
big deal for dogs because there's
Oh,
certain
really?
breeds that are predisposed to this, golden retrievers included, which is why I looked into it so
Yeah.
much when I got Bear. And there was this whole debacle years ago about um, grain-free food. You're going to
Uh-huh.
spiral with this. There was an implication that grain-free dog food was causing DCM. Now, this ended
Grain
up
free.
being a
Hmm.
huge conspiracy because Lisa Freeman, which was the veterinarian who reported this to the FDA, was actually later found to have been funded by Hills and cherry-picked cases from animals who were eating grain-free foods and didn't report the cases for animals who were eating
Wow.
grain-full foods. And it took a long time. The FDA put out like a panic statement, and to this day, veterinarians say that grain-free food causes DCM. Well,
Wow.
we later determined, and of course, they finally silently retracted their statement. So they put it out on full blast and then silently retracted it 6 years later.
That's what
We
happens.
realized that what probably happened was removing the grains they replaced them with things like legumes and lentils, things with a lot of like
Sure.
lectins and, what we would say
Lectins
like
and phytates.
anti-nutrients, right?
That's
And
right.
we
Mm-hmm.
think what happened was that those may have blocked the ability for taurine uptake into the
Okay.
heart.
Interesting.
And taurine, we can make taurine.
Dogs can.
Cats cannot. Cats require taurine. It's a required amino acid. And dogs can make some taurine. So we think what happened was
Wow.
these lectin-containing foods blocked synthesis of amino acids into
Key
taurine, and then it
elements.
caused heart disease.
Wow.
And so now I'm just curious, could there have been a second underlying component there too, not just a taurine issue, but just still the high sugar plus, some kind of,
Wow.
I don't know, I'm going down a rabbit hole, but
Yeah.
yeah.
But I'll
I
tell you
digress.
that what you just described of the cherry picking of your population or the misinformation where they just, oh, we didn't mention that aspect of the study that they replaced the grains with legumes. Oh, they didn't even mention that, is notorious throughout all of pharmaceutical research studies. And that
Yeah,
is one of the things that put Lipitor on the map back in the 1990s, was they conveniently misreported their information as a relative risk reduction as opposed to an absolute risk reduction.
Yeah.
You know the difference between those? I think I've told you before. It's just a way of presenting your data. Same data set. It's just that do you present it as a control, the results of the control group minus the event group divided by the control group again. That's manipulating your data. All you want to know is how many people had the disease that took the drug and how many people didn't have the disease that took the drug. Also, the original 4 Lipitor studies, which was Ascot and CARDS and IDEAL, and there was 4 of them. I actually had one of my articles were published where I presented this as a table. Those studies were also only done on people who had coronary artery disease, established disease. And they reported the relative risk reduction of being 36% reduction. Well, that's because they manipulated the data. You look at the same data set, and your absolute risk reduction is 1.9%. So we, as a nation, think that Lipitor will prevent you from having coronary artery disease, but the true data says 1.9%. So less than 2% of people benefit from taking a statin. Now, the other thing is that you cannot extrapolate data from a study that was done strictly on people with the disease to a population that does not have the disease. You cannot extrapolate that data. That is not right. You have to do the same study on people who don't have the disease. Maybe they have high risk. Maybe they're smokers. Maybe they don't have a good diet, but they don't have established disease. That would be but they never did that with the cholesterol medicines, ever.
Yeah. And I mean, that's the case for most pharmaceutical studies. And I was just listening to a statistic the other day. I think it was Dr. Robert Roundtree who was presenting, and he said that 90% of clinical trials are found to have incorrect results. Like they are later disproven. And also he mentioned that there isn't actually true evidence-based medicine for the majority of the population, because this trial will be about people white men aged 30 to 55 with only a history of high blood pressure, and this is the medication they used, and it showed a p-value of XYZ, and so it was significant and they should take it. Well, that doesn't apply to 99.9% of the population. And so when people say, well, where's the evidence? Well, I think that anecdotal evidence can also be extremely beneficial, right? Clinical practice, seeing what's happening with your patients, with your clients, what's happening right in front of you can be far more powerful than this study that doesn't apply to 90% of your population. So when people say, well, where's the study that shows that 3 grams of turmeric per day is going to be more beneficial for your cervical spine pain than or for your rheumatoid arthritis than this study about methotrexate? And you say, well, that study was about people who had rheumatoid arthritis and no other problems, and you just put your patient with diabetes, hypertension, and a history of stroke on methotrexate. Where's that study? it
That's
doesn't
right.
exist. So you
That's
really have
right.
to be able to kind of marry evidence-based medicine and like anecdotal evidence to truly have, and also patient preference and client preference.
Right.
Like if somebody doesn't want to drink cod liver oil, like you got to take it off their roster of things, right?
Right.
So I think there's a lot of factors that go into it.
Yeah, and most of the studies that are done by pharmaceutical companies, they're so totally biased. So totally biased.
Mm-hmm.
I read a
Mm-hmm.
study recently that they said that there was more side effects in the placebo group than in the drug group. So my question is, what in the world is in that placebo? They
Right?
choose placebos. They're not just sugar pills or whatever you want to call
Yeah.
them. They choose a placebo that has similar side effects or worse side effects so that they can come out and say in the New England Journal of Medicine or in heart.org or in the American Diabetes Association diabetes.org studies, they can
Mm-hmm.
say, "Oh, well, our drug had less side effects."
Yeah.
But
Yep.
it's all just so nonsense, and there's so much, and I also got another one of my articles, published recently about trying to bring up to the attention of nurse practitioners that research cannot be counted on. So you talk about evidence-based medicine. What is the evidence based on? Biased studies? That's not something that you wanna take to the bank.
Yeah.
But, yeah, so I just wanna move on before we run out of time because I
Yeah.
do
Yeah.
wanna talk about MASLD and
Yeah.
MASH, which is liver disease. People don't realize that they expected for, this metabolically associated steatotic liver disease, which used to be called non-fatty non alcoholic fatty liver
Non-alcoholic.
disease. They just changed the names. They said that fat in your liver, which is always diet related, it's because of eating too much carbs, sugar, and way too much fructose, which is fruit, way too much
Mm-hmm.
fruit, was supposed to overtake hepatitis B and C as the number one reason for liver transplants by 2030. Do you know that they just achieved that now in 2025?
Oh
2025, the
no.
number one reason for liver transplants is diet, fat in your liver. This to me is absolutely blowing my mind that we're moving that fast on liver disease.
Yeah.
Yeah,
That's crazy.
but it is so totally because I tell my patients all the time, I even have like a little visual that I show them about this is a normal liver and this is a liver with a little bit of fat in it. This is a liver that's now becoming fibrotic. This is a liver that now is cirrhosis. And as soon as I
Mm-hmm.
say that, they go, I don't drink alcohol. I said, it
Yep.
doesn't matter. You can get cirrhosis of the liver from alcohol or from sugar and carbs. And
Mm-hmm.
then, of course, the final one is liver cancer, which is going to take your life. So I
Yeah.
have a lady that I did a liver test on. It's called a liver elastography. It's a special type of a liver ultrasound,
Huh.
and I thought she was going to die of heart disease. No, this lady keeps coming up clean on heart disease, even though her A1Cs are always around 8.
Oh.
And but she has cirrhosis of the liver. Never
Yeah.
drank alcohol in her life. Just cirrhosis. That's what's going to. And I told her, I said, I really feel bad, but we can change your diet and slow this progression down, but that is probably what's going to be at the end of your life is
Yeah.
liver cancer.
Or you get
So
it under
sad.
control and you hope for a transplant and then don't screw up the one you're given. But
Yeah, but you know what? Once you have
yeah.
organ transplant,
Hmm.
what drug are you going to take the rest of your life, which raises
Right. Yep.
blood sugar?
You're gonna be on prednisone forever. Yeah.
Prednisone the
So
rest of your life, and that's
yeah.
going to raise your blood sugar. Oh my gosh. And then, of course, then you get into diseases like Alzheimer's disease. And don't think that Parkinson's is not right next to Alzheimer's disease as far as a
Hmm.
neurological disease affected by the metabolic function of your body. So
Yes.
people that have Parkinson's, I say to them, and I had a man who came to me. I've been seeing him and his wife for about 4 years now, 5 years. He came to me with Parkinsonian syndrome. And I said, "So your doctor's not sure if you have Parkinson's?" He said, "No." This man was very, no
Hmm.
expression on his face. He was very stoic all the time. Now, here it is 4 years later that he is off of sugar, off of gluten. He's animated. He smiles all the
Yep.
time. I said, "What did the doctor say about your Parkinsonian syndrome?" And he said he doesn't really want to call it that anymore because I don't have any markers for it anymore.
Yeah.
I said, "Ta-da, there you go."
Yep.
But but yeah,
Syndromes. I hate syndromes.
Yeah.
Because syndromes are symptoms, right?
Mhm.
So,
That's
like
all they are.
irritable bowel syndrome, right? IBS.
Mhm.
It's not a diagnosis, it's a constellation of symptoms. And
Yes.
those symptoms are warning signs, right? It's like the big flashing red light or the sirens
That's
behind
right.
you on the police car, right? It should make you stop and go,
Yes.
holy, what's happening here? And
Yes.
so anytime something is a syndrome, please don't just say, "Oh, I have it," and then, take Imodium for the rest of your
Right.
life.
Well,
Maybe
for
actually look at it and see what's
irritable
going
bowel
on.
syndrome, PCOS, which is polycystic ovarian
Mhm,
syndrome, which is really just insulin resistance for women,
mhm,
and metabolic syndrome. All of these things are a constellation
yeah,
of very, very commonly seen symptoms. But
mhm,
you're right, Kara. It's a warning sign, red lights flashing. But most doctors, your primaries, your endocrinologists, and your cardiologists do not take these things seriously.
yeah,
They just don't. And it's
yeah.
awful.
And you get a lot of, go see this specialist, go see that specialist. Like you said, that cardiologist who said to you one day, well, I'm not an endocrinologist. Well, it's all very intricately tied together, which is, where
All
I
of it
think that
is.
functional medicine really closes that gap because we understand that it is all tied together and you are not your diagnosis, right? You're not your
Uh-huh.
ICD-10 code that I billed to your
Right.
insurance company. You're a whole person with a whole constellation of symptoms and all kinds of potential triggering factors and
Right.
mediating factors and all of these things, and they all have to be taken into account.
Right.
So let's talk. I would love to get more into the type 3 diabetes and dementia.
Mm.
So I don't know if
Mm.
you know this, but in dogs, we have canine cognitive disorder, right? CCD, which
Really?
is essentially doggy dementia. And
Wow.
mhm. And people know the signs, right? And it's very similar to what happens with people. So, getting lost in the house, getting stuck in corners, barking
Oh.
or aggression suddenly, looking at their food and water dish and not knowing what to do with it.
Oh, that's so sad.
I mean, it's heartbreaking. It's very heartbreaking to watch. And studies have shown, and a good friend of mine actually just recently did a study using her functional mushrooms that she makes. Fantastic, fantastic product. We all use them in my house.
Wow. Wow.
And that she found using lion's mane mushroom, and there's a couple of
Yes.
other adaptogenic herbs, that they were able to decrease these symptoms, canine cognitive disorder symptoms, in 80% of participants in the study, which is,
Wow.
I mean, and there was no other change, right? So there were variables, right? Some were on kibble, some were on cooked food, some were on fresh food, some got freeze dried, whatever.
Right.
Some were probably on medications, some were maybe more indoor.
Oh,
There were different breeds, etc. So all different things. So the mainstay was that they all took lion's mane mushroom, and almost all
okay.
of them had improvement in their symptoms. And that
Wow.
just goes to show that there is a lot of power behind natural nutraceuticals, right? Using something that nature gave to you and the compounds that are in it to improve your symptoms. Now, I would wager that if they picked it apart and did it by different population, and they might have done that by now, and I haven't looked at the research yet, but I bet you they found that animals who were on a fresh food diet had a better response overall compared to those who were on kibble and had some
I would
response.
think.
And
I
I
would
feel
think.
like that is going to be true of people too, because now we know that Alzheimer's disease is highly fueled by high sugar.
Yes, absolutely. That's why if somebody was to Google on their in their Chrome, Google browser, type 3 diabetes. We actually have now a type 3C diabetes, which is due to chronic pancreatitis. But anyway, we didn't have a type 3 diabetes before
Mm,
this. But anyway, if you were to Google that, all the hits that come up are going to be for Alzheimer's and Parkinson's. Now, did you ever hear of Dr. Mary Newport and the study she did on her husband using coconut oil?
no.
Okay, this might help you in your practice also. So this is wonderful,
Yeah.
as well as for your listeners. Dr. Mary Newport was a pediatric neurologist, and her husband, when he turned into his early 50s, was starting to show signs of some dementia. So she did tons and tons of research, and she put her husband on a couple tablespoons of coconut oil every day.
Mm,
At the beginning, before he started the coconut oil, she initiated, and I've done this many, many times with my patients, the clock test. So what you do is
yeah.
you ask your patient to draw a clock at 10 o'clock in the morning. And it's scary what his
I'm going to see
first
if I can
clock
do it
looked
while
like.
you're talking.
Yeah. So
Okay.
I also did this on several of my patients, and I'll tell you, it's scary what these people are drawing as a clock. So what she did was, I think it was after only 2 weeks of daily coconut oil melted in his coffee or tea or soup, he was able to draw a clock that looked very much like a clock. And after a couple of months, it looked exactly like a clock. So drawing the clock test is a good way to assess whether or not your patient is starting to have trouble with Alzheimer's or dementia.
How'd I do?
Beautiful. See, now that's a perfectly functioning brain. But I would love to show you next time we get together. I'm going to show you what my patient drew, and you would want to cry.
Oh my
Okay.
gosh.
So again, coconut oil does have what they call MCTs, which are medium chain
Uh-huh.
triglycerides, which are very, very important for a healthy brain. So I have put many, many of my patients, this patient also that I'm talking about, who the clock was terrible, she's not improving because she's too far gone. Unfortunately, I can tell you some things that she has said or done in the office that she's too far gone. Giving
Yeah.
her coconut oil is not going to help her at this point. I've been on coconut oil for probably the last 10 or so years. I would love to put my husband on coconut oil because his brain really needs it. But anybody who's over the age of 50 needs
Yeah.
coconut oil every day, even if it's just a teaspoon melted in your coffee or tea every morning. And it
Mhm.
has no taste whatsoever. But that's one good way of knowing whether or not somebody has some neurological issues due to the metabolic syndrome.
Yeah. What do they call that? Bullet bullet coffee?
Bulletproof coffee. Oh,
Right?
I've been doing
Yeah,
bulletproof
yeah.
coffee for
Yeah.
10 years. Oh yeah.
Yeah, so you put the
Yeah, at
MC
least.
s it's
Yeah.
I there's, a couple of ladies in the pet space, I absolutely love them, Carmina and Carissa, and they have a company called Coco Therapy. Now, technically, they make dog products, but it's just coconut oil. And I had a
Right.
fantastic podcast with them in 2025, I think. And it was all about the many, many benefits of coconut oil. And we did talk about cognition and how, it goes through the blood-brain barrier and it gives you that shot of energy. And shame on me if they happen to listen to this because I can't remember if it was the lauric acid, the caprylic acid, or the capric acid that
Okay. Yeah,
crosses the
I'm not
barrier.
sure
I don't know.
exactly. Right, right.
There's
I'm
one of
familiar with
them
all them. Right.
specifically that goes, and we did talk about it. I wrote a blog on it too, but very beneficial. And I have also read mostly for animals, although I did read one study for people, where they talked about using MCT oil for seizures, like as a part of the therapeutic regimen for kids with seizures.
Because it could put somebody into ketosis, which is
Hmm.
very good for anybody who does have seizure disorder, to keep them
Yeah,
off of major, major doses of Keppra and all those other anti-seizure medications,
yeah.
Tegretol or whatever. So any type of food which like healthy saturated fats like butter
Hmm.
and coconut oil. And by the way, coconut oil should
Hmm.
never be purchased as a liquid because that's been chemically altered. So you do want the solid coconut oil. That
Yep.
could help a person get into ketosis, but they have to
Hmm.
avoid the carbs also. That is actually a legitimate treatment for children who have epilepsy. And
Yeah.
we've known
Keto
this since
diet.
the 1930s. Get them off sugar and carbs, and the seizures activity stops.
Yep.
Yeah.
Yep. That's what I do for the dogs. Keto diet, MCT oil, and
Uh-huh.
full spectrum hemp extract for seizure disorders.
Yes. Yes. Yeah.
So let's kind of wrap it up with a little tidbit about gut health and the microbiome.
Yes. Love it. Love it. Okay. So, just so you know, one single course of an antibiotic can change your gut microbes forever. Yes. So I'm not saying don't go on antibiotics. If you really need an antibiotic, if you
Mhm.
really do, you need an antibiotic in order to not die. So absolutely take the antibiotic, but you will probably need to be on a good quality multi-organism live bacteria for the rest of your life. I only
Yeah.
deal with two products that I
Mhm.
literally sell from my
Yeah.
practice. One of them is
Seed?
SCD. SCD,
Okay.
Daily Probiotics Team Defense. I love that product. It's a liquid, has 10 different strains of the most common good bacteria that are species that are found in the human GI tract. But
Awesome.
about a year ago, I transitioned myself to seed. Have you heard of
Mm.
SEED?
I
Love
recommend
it.
that to some of my patients. Yeah.
Recommend it. And when you
Yep.
have your own practice, Carrie, you're going to sell it. You can become a distributor, which is what I've done. So I sell it to my patients in my practice, and that has 24 strains of pro and prebiotics.
Oh, it
So
has prebiotics too. That's
it
excellent.
does.
Yeah.
24 strains
Awesome.
altogether. Did you know that the eradication of H. pylori, which we learned about when we became nurse practitioners, was essential to protect somebody from having peptic ulcer disease or even GERD, which is reflux? Did you know that the human body has evolved to have a certain type of H. pylori in their stomachs, and that is necessary, and that when you eradicate that with that cocktail of 3 different types of antibiotics and Pepto-Bismol and all these other, a proton pump inhibitor, it's a cocktail of medications that we give to people to eradicate H. pylori, that actually damages the ghrelin and leptin forming cells?
No, I
Yes.
did not know that.
Yes, I just
Very
learned about this.
interesting. Because H.
Yes.
pylori is like a big topic. And what's
Mhm.
funny about H. pylori is you should suspect it in people who have like refractory heartburn. Same thing for
Yes.
dogs, right?
Mhm.
So, because at first it causes hyperchlorhydria, right? So it increases your
Uh-huh.
acid production, makes
Uh-huh.
you even more acidic, predisposes you to gastritis, which is inflammation, ulcers, things like that. But
Mhm.
long term, um, infection with H. pylori can actually eventually cause hypochlorhydria. So now
Right.
those cells don't produce as much acid. You end up getting a more alkaline stomach environment, and
Which
that
is
leads to
bad.
all kinds of downstream effects like small intestine bacterial overgrowth, right? Because you
Overgrowth. Yep.
need the acid to
Mhm.
prevent that. It can lead to protein maldigestion, which can lead to
Mhm.
leaky gut, which can lead to
Yikes.
allergies and
Mhm.
sensitivity, right? So many problems. But I have never heard that there is a beneficial subtype of H. pylori.
Yeah, and if you I will send it to you.
Please,
It's an
yeah.
article that was written. Yes. So just so everybody knows, a good quality probiotic is very essential for all of us. Now the thing is that are you going to buy a good quality product at Costco or at Target or at Walmart? Probably not.
No,
Probably
mostly
not.
not.
They
Yeah.
give you the gummies, and the gummies are sweetened with either sugar or some fruit or something, which is
Uh-huh.
going to really work against you. So you need to see a good functional medicine practitioner who can recommend or even sell to you an excellent product. And
Yeah.
that comes from years and years of research and, like you said, anecdotal stories of people being helped by it. So
Yeah.
read the blogs of a product before you go and spend your money on it. Find out what people are saying.
Yeah.
But also IBD. We talked about IBS, which is irritable
Uh-huh.
bowel syndrome, but IBD,
Syndrome.
which is inflammatory bowel disease, which is
Eh,
generally speaking just Crohn's disease and ulcerative colitis.
Uh-huh.
That is actually a disease that is a breakdown of the mucus layer within your colon, your GI. It could be throughout the small
Uh-huh.
intestine, but basically in the colon is that what these diseases are affected, and that again leads to more leaky gut syndrome. But the whole
Uh-huh.
thing starts with not having a healthy microbiome.
Uh-huh.
So people go, well, my mother had Crohn's disease. She had half her colon removed because of it, and my aunt had this disease or whatever. So I'm bound to get it. Yes, but your ancestors, your family members, probably didn't have a good healthy microbiome because of their diet.
Yeah.
Yes, some people genetically will have more of a predisposition to have that particular disease, where somebody else will get appendicitis, or somebody else is going to get diverticulitis or some other disease. But some people have that genetic that if you don't have a good healthy mucus layer in your colon, you're going to get Crohn's or ulcerative colitis. But people just accept this as this is just my fate in life, rather than looking for a functional medicine practitioner that can recommend a good quality probiotic.
Probiotic. Yep. And there's so many things that can be done outside of these, um, biologic, uh, immune suppressing
Ugh,
medications that they
ugh, I
give
hate
people
those
for
drugs.
Crohn's. And I'm not saying that no one should use them. maybe you have the select few who are truly refractory and they really need it, or maybe we need it at first to,
Right.
get past like a super severe flare to Crohn's disease, right? So antibiotics in childhood can predispose you to Crohn's disease. High sugar diet, like you said, that disrupts your microbiome can predispose you to Crohn's disease.
Yes.
And so
Right.
peeling people off of those things, replenishing, repairing the gut lining, right? There's nutraceuticals that you can use adjunctively with lifestyle and nutrition, and there's just so much more you can do than just putting somebody on a biologic. So functional medicine, I think, really
Right.
can be a huge help for people with autoimmune diseases like that, and for people with metabolic diseases, which this also is tied to. So
Right. And hopefully people will gain enough information to look for that functional medicine practitioner. Because I'll tell you, your conventional doctor, I hate to say it, but I've got something right here where I was reading about this medical doctor who actually suggested, this is what he suggested. He says, cardiologists have endless job security, and that's because we're treating the wrong thing. His waiting room was full of patients with whose numbers I had made perfect, but who still looked sick and felt terrible. Some even
Yep.
felt worse with all the drugs I had put them on. No cures, just a never-ending revolving door of follow-up visits. And that is not why he went to medical school.
Yep.
And that's
And
unfortunately what our medical system is. It almost
yeah.
is give people drugs, keep them sick, and you have job security. And
Yep.
that's just awful. I'm sorry.
And that's what is turning people away from conventional medicine to functional and lifestyle medicine. And some people might take longer than others, but once they find their way there, they realize, oh, this is what I was meant to be doing all this time. It just took me, you went the long way
The
around,
long way
right?
around.
The long way around.
Right, right.
So so I think that wraps up our series on metabolic health. I'm sad, but this has been extremely informative, and I
Yes.
have gotten so many people reaching out and saying that they really appreciate all of your expertise and all of the knowledge that you bring to the table. So again, Dr. Olivieri, thank you so much for coming on and educating and empowering us.
Well, thank you to you also for welcoming me with open arms and giving me this opportunity. And I just am very excited to learn from you.
Thank you so much, and we'll see you next month, everybody.
Excellent. Okay. Bye, everybody. Thank you.
Thank you for listening. Please remember that you, yes, you, are the driving force that helps keep small businesses and platforms like mine running. So if you liked what you heard, please like, share, and most importantly, rate this podcast. It's the only way we can reach more people and spread the word about natural health. None of the conditions discussed or recommendations given are meant to replace the advice of your health provider. So if you have concerns about yourself or your pets, please confer with a human or animal health practitioner. Have a super fantastic day, and I'll see you next week.